We have been very measured. We knew that we would have an increase in cases as people started to have more contacts. And we've done it in a very measured and I believe thoughtful way, in that we've taken the incubation period between each step. And it is not surprising to me, now that we have people traveling more, that we are going to see more cases. But it is a wake-up sign to us that we need to pay attention to those settings where it's more likely that transmission can happen. And right now, those settings are where people are going and traveling to the interior. They're getting together with small groups, but different small groups every night. So it may be less than our 50 limit that you're having a party with, a host party or on a houseboat or in one of the restaurants. And so we need people to start paying attention again to the fact that every time you meet a whole group of new people, you are exposing yourself to their risks. And what has happened is people have come into those environments with COVID, and it has spread. So we need to get on top of it. We knew that we were trying to minimize the new cases, and that's been one of the things that we've been trying to do. We now have some clusters that are related to this travel particularly. We're managing it by the case management and the contact tracing that we're doing through public health. And that's why I mentioned today that, we have about 1,000 people right now who have been close contacts of somebody who's tested positive for COVID-19. They're now in their incubation period, and some of those people will become ill in the next few weeks. So those people, we need to make sure that we're supporting them to stay home and stay away from others, so that during that period, if and when they get sick, they're not going to spread it on to the next generation of people. So that's our focus right now. This is not a failure of anything we've been doing. We've always said that we will tweak things, we will manage things, we will make changes as we need to adjust to the scenarios that we're being faced with. So that's why we're changing the orders, for example, for nightclubs, putting in some additional measures to make it easier for the people who own and manage the nightclubs to ensure that those safe distancing, those measures are in place, that people aren't bending and disobeying those rules, particularly after they've had a few drinks and it's late at night. So we're putting in those things now. We've always said we'll adjust and we'll manage as we go, and that's what we're doing. And we're at the point where we need to make some changes, and we need everybody to be aware that these are risky times, and it jeopardizes a lot of what we have accomplished and where we have been. So we need to pay attention and use our travel manners, make sure that we stick to the basics that we know work. We do know that it's absolutely going to be higher, so that's why it's really important for anybody who has any symptoms and anybody who's concerned, who has had these types of high-risk exposures, that they monitor very carefully and we get testing very rapidly. We've shown in our sero survey that we presented last week that there's probably about 8 times more people who were infected over the last few months than we detected by the testing that we were doing. Having said that, it's not going to be as great a differential right now, because we know our testing has been expanded and our test positivity rates, so the number of positives for every 100 tests we do, still remains quite low. So that tells us that it gives us a measure of how much transmission is in the community. So yes, while I expect we are missing some cases, we're not going to be missing as many as in some of the US numbers, for example, or for as many as we missed or we didn't test for earlier on, when we didn't have the testing capacity and we were focusing on ensuring we were protecting our health system. So many of our additional cases that we picked up with the blood test were people who had traveled and come back to Canada, to BC, to their home in March, when we were telling people, even if they had relatively mild symptoms, to stay home. So we don't believe that differential is as great, but there is clearly going to be some people who have mild enough illness that it's missed. Whether they transmit it to large numbers of people or not, that's when we start to pick up. That's when we feel that we find people, if there is transmission happening, we pick up those people who become sick, because we don't have a lot of asymptomatic to asymptomatic to asymptomatic transmission. It results in people developing symptoms. which is a bit of a roundabout way of saying it.